My name's Gershon Kutsi and you're watching Mallow TV. World Diabetes Day was observed on the 14th of November, and we now introduce you to specialist physician and nephrologist Dr. Irfaan Hargey. Now, Dr. Hargey shares his views regarding diabetes, hypertension, high blood pressure and respiratory conditions. Here is Dr. Irfaan Hargey.
Hi, I'm Dr. Irfaan Hargey. I'm a specialist physician and nephrologist at Malamed Belleville. I joined Malamed in 2018 as a generalist physician, managing ICU, high care, ward patients as well as surgical patients. And towards mid of my time at Malamed, COVID happened, and we managed very critical ill patients with pneumonias, ventilated patients with end-stage kidney disease, kidney failures from COVID, and that allowed me to transition to specializing in nephrology, as I saw the increase in renal failure patients with COVID. So diabetes in our community is growing. Recently, there was a publication in nephrology showing that the burden of disease of diabetes has grown significantly in our population. So there's around 10 to 15% now of our population that has diabetes. And diabetes isn't a benign disease. It affects multiple organs, and one of the organs it affects is the kidney. And so the burden of disease, of kidney disease, has grown significantly, and we only see more and more complications happening with time. So if there are patients that have difficult to manage diabetes or diabetes with target organ damage, they should preferentially come see a specialist who will be able to help them in these matters. Diabetes is a complicated disease, it's a multi-system disease, and often it is missed out in the community. And I think that a patient that has diabetes with other comorbidities, or diabetes in the elderly, or a diabetic that is frail, we should see them and we should manage them. We should at least be reviewed by a physician. So cardiovascular diseases, which include heart attack, stroke, they are on the increase within our communities. As we live longer, as people develop hypertension, other comorbidities such as diabetes, metabolic syndromes, the incidence of hypertension-related heart diseases or strokes have increased significantly. Our nephrology has a unique view of physiology of a patient. We are able to manage very complicated diseases. With the rise of diabetes and hypertension, kidney disease is now one of the most important diseases growing within our population. And I wanted to offer the service of kidney care at Malamed Belleville. Also, I wanted to offer the service of renal transplantation for our patients, which is a very specialized disease and a very complicated disease to manage. And so it's a landscape which is improving day by day, and I feel that patients that have kidney diseases who are not sure or concerned if they have family history, they should come and chat with me, come have a visit, and we can go through that journey with them. Doctor-patient relationship is an important priority within my practice. I feel that the patient should be able to explain the disease, be comfortable to tell me about issues they're having with the disease, and one should have the time to explain to them regarding the complications, regarding the manifestations of the disease, how to manage it. Spend that time with the patient which is necessary, review the patient and go about investigating all possibilities of diseases that might manifest with that patient. My advice is not to fear the doctors. The disease is not going anywhere. We have a wonderful staff, professional nursing staff, allied health services available, and other doctors as well that are here to provide a service for you. Therefore, I think it's important, if you have these ailments, these diseases, to seek medical advice, to not delay further therapy or treatment. We are here to help, to provide a service. I believe that the doctors and the nursing staff are professional. We hold ourselves in the highest ethical standards. Coming in to see one of the doctors, delaying medical therapy will inevitably impact on your health and your well-being, and that is not what we want.
Thank you so much to Dr. Irfaan Hargey for joining us right here on Mallo TV. Should you feel that you need the services of Dr. Hargey, his contact details is on the screen. Or if you do require any medical assistance, you can contact your nearest Malamed hospital. Don't forget, our Malamed emergency rooms are open 24 hours a day, 7 days a week, and our Malamed 24 ambulance service is available on 0800 786 000. Once again, from all of us at Malamed, as always, take care of yourself and take care of your loved ones. Until next time, goodbye.